What is obesity? The World Health Organization defined obesity as abnormal or excessive fat accumulation that may impair health. Obesity of children in particular is constantly growing. It has become the one of the greatest threat to worldwide health, and Canada is no exception. In 2013, 42 million infants and young children were overweight or obese. Between 1978 to 2004, the prevalence of overweight and obesity increased from 15% to 26%. What causes the pediatric obesity? Increase of youth rate with sedentary lifestyle. Parents' influence is not ignorable as well. The easy access to high energy dense foods such as french fries, hamburgers, or soda pop. Genetics also play an important part in overweight and obesity. There are certain genes that may contain traits that can increase the chance to gain more weight than the average person. This predisposed condition and genetic trait have fair probability to be inherited by the next generation. These overweight and obese children are more likely to suffer from various chronic diseases. Type 2 diabetes, for instance, is becoming more and more common among our youth. What is diabetes? Diabetes is a chronic, often debilitating and sometimes fatal disease, in which the body either cannot produce insulin or cannot properly use the insulin that it produces. Type 1 diabetes is the immune system mistakenly attacks the cells of the pancreas. No or very little insulin is released into the body, and insulin is needed to treat it. Type 2 diabetes occurs when the body cannot properly use the insulin that is released or does not make enough of it. It can be managed with physical activity and meal planning. Type 2 often occurs due to obesity or lack of physical activity.
Now we're going to talk about diabetes in children. Most children who are suffering from type 2 diabetes are obese. The increase in global obesity may explain the dramatic increase in the incidence and prevalence of type 2 diabetes, but how many are there really suffering? In Canada alone, about 10 to 20% of the population between the ages of 5 and 14 have diabetes. This number is only increasing as the prevalence of obesity increases with it. Why do children with obesity live with the risk of diabetes, and what other risks can diabetes bring? Research has shown that children with obesity are 4 times more likely or more at risk to contract diabetes than those with a normal body mass index. Why or how are the two related? The reason obesity is strongly related to type 2 diabetes is due to abdominal fat. The excess amount of fat in the abdomen of obese individuals can cause insulin intolerance. As a result, our body cannot properly use the produced insulin. While there are other risk factors to consider, such as genetics, a low birth weight, or maternal diabetes, acquired fat deposition is a major factor that works to develop diabetes in obese children. There are also lifelong risks involved with childhood diabetes. There's a 10% greater chance of developing renal failure as an adult, as well as the development of other chronic diseases such as hypertension, cardiovascular disease, sleep-disordered breathing, polycystic ovary syndrome, and cancer. So can childhood diabetes be prevented? Because diabetes is so closely related with obesity, it can be prevented or combated with weight loss. A moderate degree of weight loss can bring down the possibility of diabetes up to 58% in comparison to children who remained obese. Along with general weight loss, a healthy diet can work to prevent diabetes. Since blood glucose level is affected by the foods we eat, cutting out foods like sugars or refined carbs work to prevent high blood sugar levels. Most junk foods and soda drinks contain high amounts of sugar and should be limited.